know that if someone close to you has the flu, you're at risk of getting it too. There's no doubt about the contagious nature of bacterial or viral infections. But what about mental health and mood? Can depression be contagious? Yes and no. Depression isn't contagious in the same way the flu is, but moods and emotions can spread. Have you ever watched a friend laugh so hard that you started laughing? Or listened to a coworker complain for so long that you started feeling negative, too? In this way, moods, and even depressive symptoms, can be contagious. We'll explain how it works, what the science says, and what to do if you feel like you've caught depression from a loved one. How depression is contagious. Depression, and other moods, are contagious in an interesting way. Research has shown that depression isn't the only thing that can spread. Smoking behavior, either quitting smoking or starting, has been shown trusted source to spread through both close and distant social ties. If your friend quits smoking, you're actually more likely to quit too. Suicide has also been found to come in clusters. One study trusted source showed that in both males and females, having a friend who died by suicide increased their own likelihood of suicidal thoughts or attempts. Depression's contagious nature may work in the same way. Researchers call it a variety of things, including network phenomenon, social contagion theory, and group emotional contagion theory. What it all comes down to is the transfer of moods, behaviors, and emotions among people in a group. And this group doesn't have to be only best friends and loved ones. Most research trusted source says that it can extend up to 3 degrees of separation. This means that if your friend's friend's friend has depression, you may still be at higher risk of developing it as well. Of course, this also works for happiness, as well as trusted source alcohol and drug use, food consumption, and loneliness. So how exactly is depression spread? It's not as simple as sharing drinks with a person who has depression or them crying on your shoulder. Researchers are still understanding how exactly emotions are spread. But some studies indicate it can happen in several ways. Social comparison. When we're with other people or scrolling through social media, we often determine our own worth and feelings based on those of others. We evaluate ourselves based on these comparisons. Yet, comparing yourself to others, especially those with negative thinking patterns, can sometimes be detrimental to your mental health. Emotional interpretation. This comes down to how you interpret the feelings of others. Your friends' emotions and nonverbal cues serve as information to your brain. Especially with the ambiguity of the internet and texting, you may interpret information differently or more negatively than it was intended. Empathy. Being an empathetic person is a good thing. Empathy is the ability to understand and share the feelings of someone else. But if you're overly focused or involved with trying to put yourself in the shoes of someone with depression, you may be more likely to begin to experience these symptoms too. This doesn't mean that being around someone who has depression will automatically make you have it too. It just puts you at a higher risk, especially if you're more susceptible. Who's more susceptible to catching depression? You have a higher risk of catching depression if you have a history of depression or other mood disorders, have a family history of or genetic predisposition to depression, were raised by a parent trusted source with depression when you were a child, are experiencing a major life transition, such as a big move, seek high levels of reassurance in others, currently have high levels of stress or cognitive vulnerability. In general, there are other risk factors of depression, including having a chronic health condition or an imbalance of neurotransmitters. Adolescents and women also seem to be more likely to spread and catch emotions and depression. Who can I get it from? You may be more likely to begin experiencing depression or other mood changes if any of the following people in your life live with depression: a parent, a child, your partner or spouse, roommates, close friends. Online friends and acquaintances can also have an effect on your mental health. With the prevalence of social media in our lives, many researchers are now looking into how social media may influence our emotions. In one study, researchers found that when less positive posts were displayed on a news feed, people responded by posting fewer positive posts and more negative ones. The opposite occurred when negative posts were reduced. The researchers believe that this shows how emotions expressed on social media can influence our own emotions, on and offline. What will I experience? If you spend time with someone who has depression, you may also begin experiencing certain symptoms. These can include pessimistic or negative thinking, hopelessness, irritability or agitation, anxiety, general discontent or sadness, guilt, mood swings, thoughts of suicide. What do I do if I've caught depression? If you're experiencing any mental health issues, you can always reach out for help or professional advice from a doctor or online. If you feel like you're in crisis, you can contact a hotline or chat line or call 911 or your local emergency services. Researchers have found that a partner or spouse's depressive symptoms can significantly predict depression in their partner. But openly discussing your worries with a loved one, especially a partner, can be difficult. Many people with depression experience shame or guilt for their feelings. Being called contagious can be hurtful. Instead, it may be a good idea to work together to manage these feelings and